Welcome, everyone. First and foremost, I would like to say thank you for your time. My name is Eric Beltran, and today I would like to be discussing regarding a proposition I have when it comes to doing our varicose vein consultations. Now, in those varicose veins consultation, we tend to take about 15 to 30 minutes every time. So when a patient comes in, they go through a set of steps. They first have their ultrasound done. Once ultrasound done, a physician assistant comes in, explains to the patient what they saw on the ultrasound, and they would explain possible treatments that we could help them out for their veins, followed with recovery process, and then at the end a contact, so we can get to see a follow up from the patient to see how they're doing after. Now those consultations, those 15 to 30 minutes time, I feel like they could be better utilized. Sometimes when it comes to those consultations, in my experience, when we do need a middleman, a translator, we would have to wait for a biopsy procedure to be done or a spine procedure to be done to get assistance from that patient or that person to be able to help us out on the consultation. And that I feel like that is one way we can improve on in our facility. We do have brochures in our work, I know, and they do show facts, but there are people that are visual learners, and if we explain to the patient about our procedure, and once they go home in a week, they'll tend to forget, and we get a call back regarding what they learned, and we would have to re-explain in a way. So when we do sit down with the patient and do a consultation, we usually in our brochure we already have the facts. Now we do this drawing already in front of the patient when they're here. So one way I could say is we can use this image added to the brochure, that way it can help us on some time. That's when we explain regarding the veins, how the deep system and the superficial system differ, of how the valves work, that once you stand up, the valves tend to close or open. If they're open, that means that there is something wrong with your blood flow, and that's how it creates the veins from showing up on the leg. Patients get scared thinking it has to do with their heart. And so this image, I would like to input it into a brochure where a patient is able to visually learn and kind of recap of what they went through in today's consultation. The page will be followed up with what we already have in our brochure, which is the procedures options, which is the laser ablation followed up with the sclerotherapy. Once the sclerotherapy is done, we would on the next side of the brochure we would have a follow-up information, the importance of wearing a stocking after the procedure is done. And at the end of the page, it would always have the contact information where we can be able to follow up with the patient. They can give us a call back, and that way it will better utilize our time. A patient already gives us a call back anyways, even after a consultation. Maybe by seeing an image, they'll rephrase, relearn what they went through on their consultation. It kind of helps them out. It could minimize the time that we spend on each patient when we do those consultations. And with that time that we save, those 15 to 30 minutes, we can utilize them more effectively by doing an extra ultrasound procedure or by doing administrative work, by adding slots on some other modality. And I feel like those little ideas, those little major key points will help us out when it comes to improving our facility. That consultation is one thing that I would like to minimize, and I feel like by adding images into our brochure, we can become more effective. So thank you for hearing out my idea. Thank you for hearing out how we can reshape our brochure, how we can be more efficient and utilize our 15 to 30 minutes better in our facility. Thank you.